One of the important mitigation strategies we use is screening for symptoms. This is performed by asking parents about the presence of certain symptoms in the morning before the child comes to school, and then screening for them again when the child first enters the school. Things like cough, headache, fever, loss of taste or smell, or any one of the other symptoms of COVID-19 that's listed on the CDC website. If someone has these symptoms, they're asked to stay home and then go see their pediatrician or their primary care doctor and consider getting tested. If there are no symptoms, then the temperature check is conducted at the door, and then they're allowed to enter the school. Another one of the questions we ask is if the student has had any contact with anyone who has tested positive for COVID-19. In that scenario, the student has to quarantine because of exposure to the disease, and while they're in quarantine, they're not allowed to come to school. Again, once they arrive, assuming they've said no to all of these questions, then they have a temperature check, they have a quick symptom check, a visual inspection by a teacher, and then they're allowed to enter the school. The visual screen is just looking for nasal discharge or anything obvious that might suggest infection that is new. Later in the day, there's a second temperature check that's taken. Again, this is just to be absolutely sure that nothing has developed during the day. And any child with a temperature over 100 is then sent home. The school does have a relationship with local pediatric clinics and hospitals to try and expedite testing and examination if the student needs it, and certainly all of that is also done after contact with the parents.